Have you been told you have a fungal infection in your sinus? It sounds alarming, but in most people, it's actually a non-invasive condition that can be treated very effectively with surgery. In this video, I'll explain the different types of fungal sinusitis, how we diagnose it, and how it is removed using minimally invasive endoscopic surgery. A fungus is a living organism that is different from plants. Unlike plants, fungi do not contain chlorophyll, so they cannot produce their own food using sunlight. Instead, they survive by absorbing nutrients from dead organic material, and in some cases, from living tissue. Because fungi thrive in dark, warm, and moist environments, the paranasal sinuses provide an ideal place for them to grow. One of the most common fungi found in the sinuses is Aspergillus fumigatus. Fortunately, simply finding this fungus does not necessarily mean it is dangerous. Fungal sinusitis can be divided into two major groups. The first is non-invasive fungal sinusitis. In this form, the fungus remains within the sinus cavity without invading the surrounding tissues. It usually occurs in people with a normal immune system and generally has an excellent prognosis. The second is invasive fungal sinusitis. Here, the fungus penetrates the surrounding tissues and may spread into the eye socket, skull base, or even the brain. This type usually affects people with weakened immune systems and requires urgent treatment. Non-invasive fungal sinusitis includes fungal ball, also known as a mycetoma, allergic fungal sinusitis. Invasive fungal sinusitis includes acute invasive fungal sinusitis, chronic invasive fungal sinusitis. Each type behaves differently and requires a different treatment approach. One important clue on a CT scan is calcification within the maxillary sinus. When we see dense, calcified material inside a blocked maxillary sinus, a fungal ball is one of the first diagnoses we consider. The chronic inflammation caused by the fungus may also lead to the formation of nasal polyps. The main treatment for a fungal ball is surgery. The goal is simple: completely remove all fungal material and restore normal drainage and ventilation of the sinus. Depending on the location and extent of the disease, this can be achieved by widening the natural opening of the maxillary sinus using endoscopic sinus surgery, creating an inferior meatal antrostomy, or, in selected cases, performing a Caldwell Luc procedure to access the front wall of the maxillary sinus. With endoscopic widening of the maxillary sinus opening, we begin by removing the nasal polyp using a microdebrider. As the sinus opens, thick fungal material becomes visible. Unlike mucus, a fungal ball is usually dark, dense, and clay-like in consistency. It cannot simply be suctioned away and often must be carefully removed piece by piece. I also trim a small portion of the middle turbinate to reduce the risk of post-operative scarring and narrowing of the ethmoid cavity. At the end of the procedure, the maxillary sinus opening is enlarged sufficiently to allow excellent drainage and ventilation. With an inferior meatal antrostomy, the inferior turbinate is gently elevated to expose the inferior meatus. A new opening into the maxillary sinus is created and enlarged using specialized forceps. A microdebrider is then used to smooth the edges and remove any loose mucosa, creating a clean and widely patterned opening. Occasionally, access through the natural sinus opening is not enough. In these cases, a Caldwell Luc procedure allows direct access through the front wall of the maxillary sinus. A side-cutting drill enlarges the opening, and a Hopkins endoscope is inserted into the sinus. This provides excellent visualization, allowing the fungal ball to be carefully removed from areas that would otherwise be difficult to reach. This is the appearance 1 month after surgery. The maxillary sinus opening remains wide and healthy, allowing normal drainage and ventilation. There is no evidence of residual fungal material or recurrent nasal polyps. With complete removal of the fungal ball and good long-term sinus ventilation, the outlook for patients with non-invasive fungal sinusitis is generally excellent. Thank you for watching. If you found this video helpful, please consider subscribing for more evidence-based information on nose and sinus conditions.